If you are considering applying to medicine as a graduate, here are 3 reasons why I would strongly recommend that you consider doing the GAMSAT. Remember, a grad is anybody who either holds a degree or will hold a degree at the time of starting their medicine degree. So if you're in your A-levels or you're applying as an undergrad, the GAMSAT doesn't apply to you. It's an exam that only applies to graduate applicants. But let's show you exactly why you should take it, and let's dive in. The first thing to bear in mind with the GAMSAT, and probably the most important, is that when you are looking at 4-year courses, so not a grad applying to the 5-year, but those 4-year accelerated courses, about half of them require the GAMSAT. So when you think about it, just by doing that additional exam, you open up twice as many opportunities or many universities available to you when you're applying tactically and you come to the point of choosing which universities you're going to go for. That doubles your chances effectively. Now with this, you also have to bear in mind the mistake that people make when they're applying as graduates is that they think that if they apply to a 5-year course, to a non-graduate course, that means they are not classified as graduates. You are still classified as a graduate, and yes, there are no 5-year courses that require the GAMSAT, because when applying as a grad, the student finance element is a big part of it. And you may or may not know this, but when applying as a grad, you're entitled to student finance on the 4-year course, but you're not entitled to it if you go via the 5-year course, because it's considered a second degree via the 5-year course, versus the 4-year course is considered a continuation of studies. Now, we have an entire video dedicated to grads, whether you're going for the 5-year or going for the 4-year course, how the student finance applies to you in this video here, which is worth checking out, but it is a big significant factor that is worth considering. So the second reason I would recommend taking the GAMSAT as a grad is that you can have multiple attempts at it and you can take your best score. Now your GAMSAT score, it's twice every year that you can have a sitting, so once every 6 months, and you can take the score up to 2 years ago. So in effect, you can keep going until you get the score that you need. Now, the reason I say this is because on the FutureDoc program, we're actually just about to start our GAMSAT training, and we have done this with lots of people now who, you'll see our testimonials where we've taken people from a 50, which is basically not very much good chance of getting an interview, to a 70, which means top of the pile and you'll have control of the entire application. So if you are thinking about sitting the GAMSAT and taking it, and you want some help to be one of those 2% of grad applicants who get into medical school, I recommend that you check out this video here to find out a little bit more about the program and how we can help you be one of those lucky 2 to 3%. The third reason that I recommend you take the GAMSAT is that it is a lot more predictable than the alternative, which is the UCAT. Now, the UCAT you can train for and you can do really well with the right sort of preparation and practice, but GAMSAT is a lot more similar to tests that people have seen before, because it's more knowledge-based. The UCAT is skills-based and it's an aptitude test, whereas GAMSAT is testing knowledge and it's your application to it. It's actually more about how you use the knowledge, and it's a certain style that's very teachable that means that we can get those results I spoke about before, where we take somebody who's doing not particularly great, way below average, and then in the top 5%. That's the kind of thing, because it's a style and a way of learning that if you get it right, you can really, it's not that the knowledge is irrelevant, but you can really work the knowledge that you have to the best of your ability to talk about it in a style or learn to present it in a way in the GAMSAT format that makes you perform a lot better than you would otherwise. And we have seen it with our grad students where we've told them to take the GAMSAT, so it's a really good idea, but they've decided not to. And in the past, we've seen people who haven't done particularly great and then really regretted not taking it and have maybe had to have another go next year because they didn't do what we said, which was to take that exam and take control of it. And then they've gone and done the training and done what they needed to do to get that result. And that way they've then got in because they've done what we said in the first place, which was to sit the exam. And it's really important to bear in mind that when you do both exams, you just open the options up. It takes the pressure off as well. Yes, it's harder doing 2 exams, and sometimes you might even do all right in the GAMSAT and think, you know what, I'll have another go at it because I've learned so much from it that I'll do it a second time. That's fine as well. But ultimately, it's about spreading your odds and giving yourself the best chance. So really, if you go in well prepared for both, you're giving yourself double the odds of doing really well. So the moral of the story is, if you're applying as a grad, to double your chances, take the GAMSAT. But remember, those 2 exams, whether it's GAMSAT or UCAT, are not the only part of the story. They are just one of 5 really big elements that you must nail to make a solid application to give you the best chances of getting in. At FutureDoc, we take those 2 to 3% odds and put them through the program and get 90 93% success of getting our students in, even to the grads, which is super competitive. So if you want to find out exactly how you can maximize your application, check out this video here to find out the 5 key stages, what the competition levels are like, and how you can even those odds into your favor to get into your dream medical school. Thanks for watching, and I'll see you over in one of those videos.